It's a pleasure to recognize the gentleman from Georgia, Mr. Carter, for 5 minutes.
Thank you, Madam Chair. Can you hear me okay?
Very well. Very well.
Oh, good. Thank you. Thank you. Thank you all for participating. This has truly been a good hearing, and I appreciate it very much. Dr. Roy, I wanted to start with you. During the discussion today, you've in your testimony, you've said that the economic shutdown has exacerbated health disparities. I know that in April you released a plan of how we could safely reopen the economy. How do you anticipate that those ideas would be helpful and beneficial to minority communities?
Well, thanks, Mr. Carter, for bringing it up. And just for reference, it's in the written testimony, but the plan is at freop.org, freopp.org, and I believe the title is something like a new strategy for reopening the economy, even during COVID-19 pandemic. And the reason why it's titled that way is because we're very concerned that we're all waiting for a best case scenario, that there's a vaccine or a treatment and boom, everything can go back to normal. But what if we don't? What if we can't get a vaccine in the next 18 months? What if a treatment doesn't arrive that's really effective in the near term? Then these disparities will persist over time and become even costlier. Imagine if the entire next school year becomes difficult to execute on. So for all those reasons, our plan really focuses on 3 areas in particular, I'd say. First, let's make sure we're focused on nursing homes and the at-risk populations, the elderly and people with pre-existing conditions, cardiovascular and endocrinological conditions. Secondly, let's safely reopen schools and let's safely reopen workplaces where it's feasible where it's going to particularly help those low-income hourly wage workers who right now have lost their jobs because their jobs have been defined by the government as non-essential and their livelihoods have been defined by the government as non-essential. And that's been a huge problem right now in terms of widening disparities. So the plan talks about that in terms of how you can strategically increase testing and use and reopen businesses where they are able to safely reopen and take into account the latest data on cleanliness, safe practices, etc.
Let me ask you something. It's been said that if there's a silver lining in this pandemic, it may be telehealth. It's been said that we've had 10 years of progress in 1 week in telehealth. How can telehealth and the expansion of telehealth in the minority communities, how can that help to resolve some of these racial disparities?
Well, listen, telehealth absolutely can make a difference in terms of getting timely access to care for the kinds of care that can be administered in a remote setting. But there's a lot of care that can't be administered in a remote setting. And so it's very important to be aware of that. And this brings us back again to Medicaid. I've talked a lot today about how access to primary care, management of chronic diseases, access to testing, all that is challenging in the Medicaid program because of the way Medicaid pays doctors and providers. I want to mention something else, Mr. Carter, if I may, which is let's talk about the dual eligible population, right? The elderly, low-income population that right now is in this completely dysfunctional system where they have 2 different federal programs, one a federal state program, one a federal program that don't really interact with each other that well. One thing we talk about in a different FREOP policy paper called Medicare Advantage for All is giving states more flexibility to integrate their dual eligible populations into Medicare Advantage-like plans that are available to some today, but could be much more widely adopted so that low-income vulnerable seniors can get integrated coverage and better access to that primary care that they need. That's something that's really important that Congress could do something about.
Right. Thank you. Dr. Brooks, I wanted to ask you in the minute I've got left, in your testimony, you talked about the importance of considering social determinants if you want to address health disparities. And one issue that I've been working on is ensuring that Medicaid beneficiaries have access to non-medical transport. In fact, Representative Cardenas and I have introduced Protecting Patients Transportation to Care Act, and that codifies the NMET, the EENEMT benefit in the Social Security Act. We've seen some progress on this bill, and I hope that we're going to be able to get it passed. It needs to be passed. Can you talk about the importance of addressing things like transportation and other social determinants in order to tackle health disparities?
Yes. So transportation is a major barrier to achieving access. We have transportation service at my health center, but now they're shut down because of COVID. So non-emergency medical transportation would be very helpful. And just very briefly, the telehealth. So telehealth is very important. I mean, that reduces the need for transportation. It's suboptimal to a physical evaluation, but it's much better than no evaluation. So addressing transportation, I think, is very important and will lead to better outcomes.
Good. Again, thank all of you for your participation today. Thank you, Madam Chair, and I yield back.